I'm Dr. Fiona Lovely, and this is the Not Your Mother's Menopause podcast. I'm taking the taboos of menopause and perimenopause and bringing light to the dark. No bullshit, no shame. It's time for us to gain a new paradigm in female health, out with the old and in with the new, and I'm bringing fresh perspectives from someone in the arena. I've been practicing women's health for nearly 20 years, and I'm spilling the tea on what it means to live at midlife, knowing that the best is yet to come. I'm sharing my Gen X approach to living through this transition. Sassy, a bit sweary, and always honest. Tactical tips and instantly usable information is my aim. I hope to make you laugh and that you learn something new that helps you embrace the change. Together, we bring power to the peri. Onward to the podcast. We live in a time of unprecedented stress and an awareness that this isn't a healthy way to live. But what can we do to signal calm and safety to our brains so we can feel happy, sleep better, and relieve stress? Long-term health and longevity matter to me, and I use the Apollo to help. Apollo is a therapeutic wearable that works by sending gentle vibrations to the body that signals safety to the brain. It's a non-invasive way to relax, get the sleep you need, focus attention, and get into that creative flow state. With consistent use, the Apollo retrains your nervous system, encourages recovery and calm, and relieves stress to help you feel better overall. It provides continuous support for mental and physical health, and I love it. Since I've been using my Apollo, my sleep is deeper and more restful, my HRV is higher, and I notice my days are spent in a calm and aware state rather than reactive and stressed. Apollo is offering 15% off for listeners of the show. Please visit apolloneuro.com/lovely. That's APOLLONEURO.com/LOVELY, or use the code LOVELY when you check out. Apollo is scientifically validated to show significant benefits. It even has an awesome stay asleep feature. It detects early signs of waking in the night and delivers gentle vibrations to keep you asleep. Check out apolloneuro.com/lovely for 15% off the Apollo wearable technology. It's important to me that the supplements I use are of the highest quality, and that's why for more than 3 years I've been drinking AG1. It is researched and developed by an in-house team of scientists, doctors, and nutritionists with decades of experience in their respective fields. Quality for AG1 isn't just a buzzword, it's a commitment backed by expert-led scientific research, high-quality ingredients, and rigorous testing. I know I can trust what's in every scoop of AG1 because they obsess over product quality, the standards of manufacturing partners, and sustainable practices. It's easy and fast to use. Drinking AG1 mixed with water in 1 scoop a day covers my nutritional bases. Prebiotics, probiotics, digestive enzymes for gut support, B vitamins and rhodiola for energy support, folate, magnesium, and ashwagandha for stress support, and vitamin C and zinc for my immune health. So if you want to replace your multivitamin and more, start with AG1. Try AG1 and get a free 1-year supply of vitamin D plus K2 and 5 free travel packs with your first subscription at drinkag1.com/Fiona Lovely. That's drinkag1.com/Fiona Lovely. Hello, listeners. I'm Dr. Fiona Lovely, and this is the Not Your Mother's Menopause podcast. And today I'm bringing you, hopefully, a very useful and helpful episode on mental health during the perimenopause and menopause years. This is a really big conversation. I'm having more and more discussions in the office on this very topic, and I felt it was time for really me to bring you the best information that I could compile. And the good news is there's new research coming out, new data coming out all the time that is correlating these events, the hormonal change at midlife we call perimenopause, and decline in mental health for many of us. So recently I read that many psychotropic medications, prescriptions, that is your anti-anxiety, antidepressant medications, antipsychotics as well, actually have estrogen suppressing effects on the brain. Whoa. I've been doing this a long time, but that was new information to me. And I thought, you know what? We really don't understand the menopause brain at all if we're still prescribing antidepressants and anti-anxiety medication for women at perimenopause. Sometimes it is warranted, but a lot of times there are much better options. So let's talk through that. It's time for the knowledge to speak. So women have been wondering, and I've noticed more and more frequently in the office, if their experience could, with their brain health, with their mental health, could be related to the menopause transition. And the answer is yes. Here's what we know. Women's brains are estrogen fueled, and we are hardwired this way. When estrogen leaves the building, and we experience the slow decline of progesterone and testosterone, which happens between the ages of 40 and 60, as early as 35, can also be later, what we feel is anxious, low mood, brain fog, paranoia, anhedonia or loss of pleasure and joy, irritability, dissociation. So that is an inability to connect with the things that have always brought you happiness, pleasure, and joy, okay? Whether it's a job, a relationship, a partnership, a friendship, a favorite hobby, we can dissociate from those things. Insomnia, feelings of low worth and low confidence. Wow. So this is typical menopause. Has anybody told you that? What I want you to hear now from me is that what you are feeling right now is normal for menopause transition. That doesn't mean you have to suffer, but it does mean you can ask for a better level of understanding from your healthcare providers. I'm going to give you more information on that here shortly. So we have hormonal changes that happen that impact brain function. Estrogen, progesterone, and testosterone, which are the primary hormones that decline at perimenopause, work with the neurotransmitters. And they work like this. They work on GABA. GABA's job is calm. They work on dopamine. Dopamine's job is memory, motivation, and mood. These hormones work on serotonin, which is responsible for focus, happy, and calm. Norepinephrine, which is responsible for arousal, attention, mood, and memory. And beta endorphins, which are responsible for stress relief and pain management. So when you have the decrease of the estrogen, progesterone, and testosterone, you also have the decrease of all of those lovely neurotransmitters that bring you a certain juiciness of life. These are causing changes to our emotional state. So women between the ages of 30 and 60 are twice as likely to be diagnosed with anxiety and depression. 75% of us will have brain symptoms by the time we stop cycling. We can have worsening symptoms of previously known disorders like ADHD, anxiety, depression, schizophrenia, even psychosis. There's some interesting data sets on psychosis being resolved by supplementing estrogen, by the way. Isn't that fascinating? Bipolar disorder, trauma no longer modulated by estrogen then rises to the surface. So estrogen keeps these things dampened down so that you can get busy about the business of biology, which is essentially reproduction. So our limbic brain gets activated and emotions and reactions are amplified. Our trauma comes up to be healed. It's literally a perfect shitstorm, I like to say. It is no surprise to me that women between the ages of 45 and 50 have the highest rates of suicide. So if you are listening to my voice, Please know that what you are experiencing is quite likely a normal part of the menopause transition, and keep asking questions of your healthcare provider. There will be somebody out there who understands and can prescribe you the right thing. So imagine if our healthcare providers and our employers and our families understood that perimenopause, between the ages of 35 and 55, means neuroendocrine changes which can destabilize our mental health. Imagine a kinder world if we were better understood. So what's the remedy? Well, I've got some things I've got in my mind. Rest for sure, which some of us can take and some of us can't. It depends on our socioeconomic situation. Vacation, same thing. Half-time work, same thing. Early retirement with menopause pay is something I see being a realistic option in the future, but we're not there yet. I'd love to see allied health professional coverage for all chiro, physio, massage, pelvic floor help, etc. So there's the basic information. What you're feeling is you're not crazy, it's menopause. So how can you help yourself? Well, number one, prepare for the storm by knowing it's coming. When you are still feeling good, I want you to have a list of things you can do immediately to feel better. Maybe it's 5 things you have in the notebook on your phone. I just have some examples like singing and dancing, taking a walk in nature, calling a friend, reading a great book, journaling, or doing the wiggle. Go to my social media, and there are videos posted on my social media the week that this episode gets released that will show you what the wiggle looks like. All you're doing is discharging stress. So one of the things that's really important is that when we get into that place where we're perseverating over how we're feeling, get into some embodiment experience, like get into your body and out of your head. So jump around, dance, sing, hum, call a friend, whatever it takes. Let's talk about work during this time. This is a really big subject, and there's actually lots of research being done on this very thing and lots of discussions happening around what happens to women in the workplace at perimenopause and menopause. Most of us are in the prime of our working lives when it comes along, so we should be up for those glass ceiling positions. And unfortunately, a good number of women have to turn those positions down because they don't feel like physically or mentally they are capable of it because of the symptoms of menopause and perimenopause. And keep in mind, these symptoms rob us of our confidence. So we can spend decades getting confident in a job that we love, but when we're offered the CEO position, we have to turn it down because we don't think we can hack it. It's a damn shame. We are losing so much wisdom when that happens. I suggest talk to the HR, talk to your supervisor, talk to admin about your experiences so we can be supported. Allow yourself to be supported. It's interesting about the admin. I'm Gen X. I grew up, you just don't talk about the things that make you seem, I don't know, vulnerable or weak or something ridiculous, I'm sure. So when I started having sleep issues in my own perimenopause, I just muscled through it during the day. I see patients till 6 o'clock at night. So sometimes I'd be awake at 3 o'clock in the morning and I'm still seeing patients at 6 p.m. And I didn't speak up about it because I didn't want to be the weak link in the chain, all of that stuff. And then I realized that my administrators are all women in their 20s. And I thought, my God, if someone had told me when I was in my 20s what was coming, I would have felt so much better prepared for it. And so I started getting loud about it. And if I come into the office and there's a gap on my schedule, I haven't slept well, I have the admin block that off. First of all, patients deserve a much better version of myself than the tired one, but maybe I'll have a little snooze on my table. Maybe I'll just rest up and relax. And I'm loud about it now. I'm like, hey, I didn't sleep so well. Please block that off. And I have great supportive staff. But I also want them to know what's coming. I believe that there can be no denying or discriminating us if we all speak up. We would be a tidal wave, impossible to ignore or deny. And just as we need support through pregnancy, we definitely need support through menopause. And we're going to start to see that rising. There's enough of us talking. After so many years of shouting into a void, we're actually being heard. The ones early talking about the menopause, the significance of the menopause transition, if you will. Mitochondrial health is a critical piece of longevity and aging well. But where do we learn how to take care of our mitochondria? The powerhouse of the cell, providing us energy and strength. Mitochondria are in every cell in our body, our brain, and our muscles. Menopause is a time of reduced energy, causing fatigue, muscle loss, brain fog, changes to skin appearance and body composition, reduction in strength and endurance. These changes aren't just annoyances, they can seriously impact overall health and longevity. I get help with this using MitoPure from Timeline Nutrition. It's a clinically tested urolithin A supplement that rejuvenates the mitochondria. These innovative products use this natural compound to trigger an anti-aging pathway in our cells called mitophagy. The research behind MitoPure is robust and impressive. I feel stronger and more energetic since taking the MitoPure soft gels. I've seen the science, and I rest well knowing how MitoPure is working to rejuvenate my mitochondria. The serum leaves my skin smooth and hydrated, and I've seen the fine lines around my eyes and forehead get softer with my very first use. It's a moisturizing powerhouse with longevity benefits. Yes, please. Timeline is offering our community 10% off your first order of MitoPure. Visit timeline.com/lovely to learn more. That's timeline.com/lovely. timeline.com/lovely. Okay, number 3, hormone optimization. Because hormones affect our mental health, and you may not be thinking 1 + 1 = 2, hormones plus mental health, or hormones plus decline equals low mental health, low mood, low confidence, etc. I want you to start thinking in this way. Your doctors need to start thinking in this way too. Estrogen, progesterone, testosterone, DHEA, and cortisol all affect mental health. Certainly the thyroid hormones do as well, and more. So optimization of hormones is really important if we're talking optimal mental health. I personally think this is a fascinating time to be alive, because when I pop into Instagram, I'm seeing all these like 50 plus women who are super buff, who are eating protein like crazy, who are on the hormone patch and the progesterone and all of that. And I'm like, look out. What a great time to be alive and see that happening. That's how Generation X is doing aging. Yes, please. Because we are wise AF, and we're in the process of getting ourselves physically well AF. Number 4, I want you to have a support team. Who is it on your support team that can give you the best experience during your perimenopause? Is it social worker psychology? Is it a massage therapist or cranial sacral practitioner, acupuncturist, chiropractor? Move more often. Activity is a powerful antidepressant, anti-anxiety, has anti-anxiety function as well. Perhaps your trainer or your instructor is on your support team too. Number 5, correct common nutritional deficiencies. That could be the most common ones I see in my office: B12, vitamin D, as in dog, zinc, iron, omegas, a multi-mineral, and magnesium. Now, depending on your own health history, you may be more likely to be one of these than the other, or you could be all of them. So certainly talk to your naturopath, your functional medicine practitioner, about what that could be for you and how to best get those nutrients. Emotional regulation. I want you to be so crystal clear on when you are feeling dysregulated, when you are feeling stressed or without energy, fatigued, when you are feeling overwhelmed, and have the tools to regulate your nervous system. What does that mean? You need calm, you need to de-stress. Do the wiggle, do the gargle, move your body, hum, sleep, take yourself out of the situation. There's so many things that you can do to actually feel better in the moment. And again, this is part of that toolkit. I think it's really, really important. Okay, that's what I have for you today. I hope you feel heard and you understand better what's going on in your own life, in your own brain. Do not suffer in silence. There is lots of help to be had. If you're in the United States, there are plenty of online menopause clinics that will help you with this. And of course, this is what they do. They know it, they recognize it. They're not likely to give you an antidepressant if you actually have low hormones. They're likely to give you replace the hormones first, and then say, okay, are you still experiencing these things? Then we talk about potentially a psychotropic medication. If you're taking an antidepressant or anti-anxiety medication, please talk to your healthcare provider and ask them if you could benefit from HRT. There is an episode called How to Talk to Your Doctor About HRT, because for a lot of women, this feels confrontational, especially when the doctor has been vocal about being against that. Remember, your doctor's not in charge of your health. You are. Advocate for yourself. Ask the questions. Be aggressive isn't the right word. Be firm. If it's what you want, ask for it. If they won't give it to you, then find somebody else. There's always other people that can help out. Go to your pharmacy in your neighborhood and talk to your pharmacist and ask who in the neighborhood is prescribing those medications, who's prescribing hormones well. That's the doctor you want to go see. So again, I just hope that the dispensation of this information, as much as I needed it for my own assurance and the assurance of my patients, I hope that you feel assured, knowing that you're not losing your marbles. It's just temporary. And what you're experiencing is the retreat. That's the best word. The retreat of these hormones from your brain. And your brain is hardwired to use these hormones as fuel. So of course you're going to feel off. And it's okay. And I love you. And I thank you for listening, as always. If you ever want me to cover a topic, please send me a message on Instagram at Dr. Fiona Lovely, one word. And follow me there, please. And subscribe to the show if you love it. Please leave a review. I would love to hear your thoughts on it. Until next time, take care of yourself. The information and other content provided in this show, or in any linked materials, is not intended and should not be construed as medical advice, nor is the information a substitute for professional medical expertise or treatment. We are doctors, but we aren't your doctor. Seek your doctor's opinion. If you or any other person has a medical concern, you should consult with your healthcare provider or seek other professional medical treatment. Never disregard professional medical advice or delay in seeking it because of something that you have heard in this podcast or in any linked materials. If you think you may have a medical emergency, call your doctor or emergency services immediately. The opinions and views expressed on this page and in this show have no relation to those of any academic, hospital, health practice, or other institution. Thank you.